Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a lot more about the Public Health and Wellness Department of the VNA and how much work they are actually involved in out in the communities and within the agency. We're lucky today to have as our guests Mary Devlin, who's on the outside. She's the manager of the program. Thank you, Mary.
Thank you,
and
Jeanne.
Kathy Ganey, one of our public health nurses. Correct?
Hello.
Thank you both for being
Hi.
here. I appreciate it.
Thank you.
Now, I always like to start with the viewers getting to know you a little bit. So I'm going from the inside out. Kathy, I'll start with you.
Okay.
How long have you been with the VNA?
I'm with the VNA 5 years.
So
I just had my little 5-year anniversary the end of last year.
so you got your pin?
I have my pin
there
right
you
here.
go.
Yes,
Good.
there you go, yes. And I've been nursing over 40 years, and about 17 of them now have been with public health.
Wow. So why public health? Did you have a special interest, or you just went that way and loved it?
Not really, but when I think back, a lot of what I did was public health. My children, when we were living in New York, went to a parochial school where I was the school nurse, but didn't get paid for it. And I did all the health screening, and I taught a human sexuality course and a few other things.
At a parochial school?
Yes,
Wow,
yes.
good for you.
And then when I moved
Bold
to
move.
New Jersey, I didn't want to go back to hospital. And I saw there was an ad in the paper for VNA, which I knew where the town was because it was next to mine. And I interviewed, and when I went to work for them, I did a little bit of everything. We did hospice, and public health just seemed to be what came to be mainly what I wound up doing, and I loved it from
And
then.
you loved it.
And then I came to the Cape, and I was lucky to get this job
There
here.
you go. Great, great. What about you, Mary? You have...
Let's see, well, I've been with the Visiting Nurse Association now for 12 years, this time around.
This time around?
I was with them earlier than that, left for a little bit, did a few other things, and of course came back to the Visiting Nurse Association. It's just one of those agencies that you come back to
Yeah.
because it gets into your blood.
Yeah.
So,
You've been doing public health for a little while, though.
I've been doing public health for quite many years. I don't think I really want to tell you how long.
That's okay.
Over the 25 mark, I know that. I was doing that when I was living in New Jersey as well. Being in visiting nurse and being associated with that puts you in public health because that is who we are. We are the public health nurses for the communities that we're serving.
Right.
We're doing the this for the communities. So.
Okay. So that's sort of an automatic when you get into
It is.
visiting nurse. Yeah.
Visiting nurses, they started out as public health nurses actually in the very, very beginning.
Yeah,
They
that's right.
Right. So many people look at the VNA as home care and going in and doing nursing visits and physical therapy, but the VNA itself is public health. It is wellness and looking for the community, the population wellness.
Right. That's interesting you would say that. I think of that painting that we have in the lobby of the nurse coming to the door, and it's the Public Health Nursing Association.
Yes.
Is how they named it. We don't know how old the painting is, but it was us, and they came in the blue jackets and hats, so some of the viewers might remember that look or that brand that the public health nursing had for many, many years.
Right.
So they're easily identifiable that way.
Right, and public health nursing has always been, the nurses that go into it have always been interested in the community and teaching wellness and going and doing the well baby visits we started out doing.
Right, yeah.
Right, and when we originally started with the visiting nurses, we were going in and teaching moms and babies and families how to do good hygiene to keep people well at home.
Yeah.
So,
Yeah.
yeah.
See, the early roots of it all.
Early roots,
Yes.
right.
And now it's grown to be so much more, right?
Yes, it has.
So let's talk just a little bit about under the umbrella of public health and wellness for the VNA, what kind of programs do you oversee?
We have contracts with health contracts with many of our
Okay.
Cape Cod towns. Actually, it is 16 towns at this point because we also go over the bridge. And we provide their wellness and prevention programs. We provide blood pressure clinics in in all the communities, at least on a monthly basis, if not weekly in some communities. We do health screenings, we do cholesterol screenings, diabetic screenings. We provide wellness education programs. We do child immunizations. We still do have well baby visits. We still have those maternal child health nurses. And Kathy is one of our public health nurses and particularly focuses on the Upper Cape area. So Kathy, maybe you just want to talk a little bit about what you do in Falmouth, Mashpee, and Bourne.
So just before we do that, I'm just so that people understand, that's okay. So this is part of a contract that once upon a time every town had their own nurse.
Correct.
And then with budgetary constraints and just the availability of, if you contract with the VNA, you get so much more because you get more than just this one person that comes to work every day.
That's right.
So now that's where the 13 Cape towns and 3 off Cape that we have contracts with that are they renew every year?
They renew every year.
So you work with someone at the town?
We do. We work with the health agents in the town, and then every town is different because, remember, every town is individual. Every town has their own government set up. And some towns, the public health nursing contract is really under the Human Services Committee, and in some towns it is under the Health Committee. It just depends on how the town has established their own structure. But we do work with every single town, and we always work with every single health agent. And also the Council on Aging directors are very important to the contract as well.
And that determines what kind of programs are being offered in each individual town?
Absolutely.
Okay.
Every town has their own little flavor, as we know on the Cape. Every town is different. And what I find is when we do health fairs or do blood pressure screenings or any way of meeting the residents of a town, they don't really, a lot of people aren't aware that we are the town nurse, so to speak,
I think
with
that's
quotes.
Right. Yeah.
I did the emergency services fair in Falmouth, and when I met people, I said, "I'm your town nurse," and they go, "Oh, we didn't even know we had a town nurse." And so, really important, I think, that we get the word out there that they do have a town nurse.
Right.
From the VNA, what I like to explain to people is your tax dollars at work, because your town is using their contract to contract with us to do the needs of the public health needs in the community.
And this program broadcasts in all the different towns, so every viewer will recognize something different, whether they've seen you at a flu clinic. I think that's probably the
That's
biggie.
what they think, and I don't think they realize there's a lot more to it that goes on there.
Yeah,
but,
so let's talk about that. So you're the Upper Cape?
Yes, I have Mashpee, Falmouth, and Bourne.
Okay.
And they're all different contracts. Like Mary said, they're all different, what the needs will be or what the town wants to spend their dollars on. Okay. I'll give Falmouth as the best example because that's where we're pretty busy.
And that's where we started many years ago.
That's where we started.
So we have our roots in Falmouth.
Yes, the VNA is very well known there in Falmouth because they are their little community. And I really enjoy Falmouth very much. There's a lot that goes on there. Actually, our public health and wellness office is really in Dennis, but I have a spot in Falmouth, so they could be down at that end of the Cape to be pretty ready, not that we're an emergency service, but to be readily available and be right in the community.
You have the resources there
and
in Falmouth.
It's helped because I try to, I like people, like you say, we're a whole agency behind Mary and I and the girls that work in public health, but we've tried to make one face be the person that they know. Oh, I've met you before, or something like that, and I think it's working. I do get phone calls from people, residents that will come and say, my friend met you at a blood pressure clinic. She said you could ask me questions. And I've made the blood pressure clinics not just blood pressure clinics. Sometimes they bring their pills with them. Sometimes they bring their cuff from home. I have them bring because they say, I don't get that when I'm home, and we see if it's working,
blood pressure? Yeah.
or if they're doing it correctly, or a few people have just come and wanted to speak.
Oh, yeah.
Depression or stuff like that.
Yep.
And I really enjoy it. I really enjoy it. And then we also do
So it's more of almost like an Ask a Nurse.
It is.
Kind of form.
We call it a blood pressure, but we do it all.
Yeah.
We try to be
that's good for people to know. I think for viewers, if they
Right.
are familiar with the blood pressure clinics and maybe, oh no, I'm not going to go, but I'd really like to ask her about something else, that they can do that.
They can. They certainly can. And then we do for the towns the communicable disease surveillance.
Okay, yes,
which
let's talk
is,
about that.
It's a computer program. It's generated from the state. It's called MAVE in Massachusetts, Virtual Epidemiological Network.
Oh, good for you.
Right.
And
You tested later.
all of the communicable disease from anywhere from salmonella to Legionnaires or
Yeah, what have you seen? Have you seen?
a lot of tick. Right now, ticks are a little
yes.
slow, but once
Yep.
the weather starts warming, we'll be seeing all the
Yeah, they don't like
the
that below
tick-borne
zero
disease.
temperature.
Yes,
Right? Yeah.
so that's keep that population.
Yeah.
But that can involve something very simple as to calling the patient and finding out if they have any idea where they might have picked this up, what their background is, what their medical background is.
So how do you hear about it in the first
The
place?
state, it comes
state?
up on a computer program.
Okay.
We have to have
Alerts
access
us,
to it.
Alerts the VNA.
Right. We have
Okay.
access to this program
Okay.
for the towns that we cover.
Gotcha.
So the towns that we cover, plus on the other side of the bridge, we have access.
Okay.
And we go in and we manage. What we're really trying to make sure is not going to be an outbreak
Sure, yeah.
of, use the easiest, salmonella or something like that,
Yeah.
that we want to try to nip it in the bud. Like if we were to find out that 5 people, separate people, ate in one restaurant, and they all
right.
came, something like that. So
Yeah.
that's an interesting part of the job.
Yeah.
It can be very interesting, or it could be, sometimes we even have to go to the patient's home because it's quite more
Oh yeah. Are they
involved.
surprised to hear from us?
Yes.
Yes,
They
some are.
usually
How did you
Some
know? How did you know I had salmonella?
Yes.
Does it go that
Yes,
way?
yes. Some people are initially a little leery because they say, how did you get this? And I said, you know, you're a number and a name to me, but by the time all this information is compiled, you just become a number. So it's just they want to make sure that we're not having an outbreak of
Right.
anything.
I think what's really important with the VNA having the contracts with the 13 Cape Cod towns and the 3 over the bridge is that we are their public health nurses. We see their communicable diseases. So we're seeing this globally across the Cape. So if there is something that is connected from one town to another town, we can see that regionally, so to speak, and then we can respond, on a regional level too.
Oh, right.
So it really is regional public health nursing that we're doing. The only towns that we don't work with are Barnstable and Sandwich, but they have their own public health nurses, and we have a resource there where we do communicate with those public health nurses as well. So we really are the Cape Cod public health nurses.
Right, right. What's the benefit for the town to contract with us rather than have their own?
I think the major benefit is that we are in every town on the Cape. We have a much larger agency behind us. We're not just one little single nurse sitting in one little single office. We have a wealth of experience behind us with being part of the VNA of Cape Cod. At any given time, we can call in any of our expertise. We can call on our wound specialist. We can call on our infection control people. We're also part of Cape Cod Healthcare, so we're connected very well with Cape Cod Healthcare's wealth of expertise as well. So we can pull all these resources in.
So you can tap into all the other resources
Yes.
that are available.
Right.
Good.
Which if you were just by yourself and isolated, you wouldn't be able to. So
Right.
that's a big benefit for
It
the
is,
VNA.
yeah.
Yes.
Yeah, that's good to know. So back to blood pressure clinics, which are more of a wellness clinic. Then we have the communicable diseases, their surveillance. So you keep track of mono or other things that could be
Well,
out
it
there
wouldn't be
spreading.
mono, but that's not identified. Certain ones are identifiable.
Oh, okay.
And some are not.
Yeah, are there some that people might be more familiar with that they might hear about? I know we had one a couple of years ago. There was something in the Outer Cape that was.
Well, I think what people get concerned about is when they hear any kind of like a disease that's associated with foodborne.
E. coli.
E. coli.
I should have used that as an
right.
example. Yeah.
Yeah. Hepatitis A sometimes can be kind of scary for people. The salmonella can be a little scary. But then again, because we work very closely with the epidemiologist at the Massachusetts level, we can many times we get involved in investigating maybe just one little case in one town that's associated with something that's in Western Mass. So we had that communication back and forth.
We did have a case like that, yes, that I had, the case they were concerned with, without giving too much away, was something that went on in a different part of the state. but 2 people in a town here had. So that was a little more investigative. We had to investigate family, friends, and
had they traveled and all of that.
and in tuberculosis case, you have to get all the contacts, and we're responsible for seeing that they've all been tested, and then retested about 8 to 10 weeks later, and oftentimes direct observation therapy is called into use because we have to go out 5 days a week and actually see the people take the medicine.
Oh yeah.
So it's a lot. It can be involved,
yeah.
but it's good.
Yeah.
I actually enjoy the diversity and the variety. I do
seems
like it.
Yeah, there's a lot of different things
Again,
that you're
this is
involved in.
protecting people's health.
Right.
It's protecting things from getting out of control and becoming much more serious.
So there's usually an annual health fair in the towns, but it seems like every town chooses that. And you facilitate those as well?
Yes, we do.
And again, because we are part of a much larger organization, at those health fairs we can pull in so many other expertise. This past year we were able to provide a practitioner, a Reiki practitioner to the health fair. We have an aromatherapy. I think they're specialists. They've been certified in aromatherapy from our hospice department. We have a nutritionist that comes to our health fairs now. She's also a dietitian. And we have a diabetic educator. So we can add all these little extra services. So it's not just a health fair and come get your blood pressure taken. We have all these other services that surround this health fair, and people can take advantage of all these other services.
Massage therapy.
Yes.
And they love it. They love it. The aromatherapy, and they do really enjoy it.
And then you do the blood pressure is usually glucose.
Glucose, cholesterol. We
BMI.
do body fat percentage, BMI, bone density. Our bone density is actually, we have a technician that comes with a bone density machine. So we're really adding a little bit more of a technical support to that bone density.
Great, yeah.
So then the nurse, the RN, can interpret the results for the person. And it's not just giving results, we're teaching. And we're helping them to make choices in their lives, either to change a diet or maybe to increase exercise, to help them to make some difference in their life.
Take better care of themselves.
Better care of themselves,
Excellent.
Right.
So what else as part of the town contract? So the health fairs,
well, that's
other
a great way to do
immunizations?
the exercise programs that we offer, the Young at Heart and
We have we do walking programs through the town contracts. Right. We have a Young at Heart exercise program in many towns, and the Young at Heart exercise program is an Arthritis Foundation exercise program, and it's an evidence-based exercise program. It's weight strengthening and conditioning, and it's 2 times a week for 8 weeks.
Great.
And we originally started our Young at Heart program. We really thought that people would come and do this program for the 8 weeks and then graduate and go on. But they really enjoy it, and they find it so beneficial. They stay. So they re-enroll again.
That's great.
So we have people now that have been with us for quite a few years, and they really have been able to maintain themselves healthy and strong at home because they've been coming to the
So it becomes an ongoing exercise program, usually offered at the schools or senior centers? Or
it is offered in many different places. We have a couple in a church. We have a couple in senior centers. We have, I think we have one going on right now in a community center. So it depends on where they would like us to go. We'll go. We're very flexible. So if a host agency would like us to come out and present a program or do an exercise program, we'll go. So we're usually there. We say yes.
So if we have a viewer that's watching now saying, "Oh, that sounds like a fun class. I would like to do that." They could just check with their town, or they can check with you guys.
Right. Exactly. Right.
And theoretically, they could check on our website.
Yes, they could check on our website. The programs are listed there, too.
Yeah, all the programs are listed on the calendar, all the classes.
And all councils on aging have their own little newsletter
and flyers.
And there should be information in there as well.
All right.
You know, and we talk a lot about councils on aging, but we also go into schools.
Absolutely.
We have and this is also part of the Public Health and Wellness program, we have a nutrition program. It's called Nutrition Detective. And it is supported by a grant, and then it is also supported by some of the town contracts as well. But we have a nurse who has nutrition background. She actually has a degree in nutrition. And this Nutrition Detective program is another evidence-based program. It has proven results. It's for the elementary school children.
Oh, nice.
And she takes it into the school systems, and she does this program at the elementary level. And we're actually teaching that age group how to read labels. and how to make difference and good choices. And they go back home then, and when they're shopping with mommy or daddy, they're telling mommy and daddy about that label and about that choice.
That's good.
So it's really interesting. The school nurses that have brought us into the schools to do this have asked us to come back again.
Wow.
So it is a program that we're seeing is very well worth.
So that's an ongoing, is it just, what was it, grade school? Elementary?
It's elementary school. It's meant for the 3rd and 4th grade level, I believe.
Okay.
So it's that younger age level.
So what do they do? Present a class once a week, or
it's only a 2-week program. They go. She goes in and she presents the class and presents the information. And actually brings she does a pre-test. And then she presents the program and presents the information. There's a little video that I think that goes along with it. And then she goes back the following week, and they have like a little project. And then they review the project, and you can see the results from one week to the other. And then she does post-test scores, and you can see the improvement in the scores.
How much they've learned.
Too.
Wow, that's great.
So.
That's the time to catch them, huh?
It is
It certainly is.
Yeah.
Right.
What else, part of the town contracts, what else do you have?
Well, also in the schools, not a most pleasant conversation, but we've had times where we've had to go into the school because they've had lice that they've not been able to
get a hold of that,
get a handle on.
Yep.
And I've even made home visits to make sure the mother understood how to,
take care of it.
Take care of it. Maybe if they weren't doing it properly, whatever. So usually around September we hear those calls. But the school nurses will call. I mean, I've had many a call from a school nurse just asking a question about chicken pox or anything like that, or lice. So I think we do have a pretty good, and since we do flu shots in almost all the schools too, hopefully they know that we're the people to come to.
Right. And we do child immunizations.
Oh, so there's other immunizations other than flu.
Right.
Okay.
We're part of the Vaccines for Children's program, so which means that we get vaccine from the state who purchases the vaccine for children so they can be immunized.
Okay.
And we provide the immunizations for the population. We can go into the schools, and we have been invited to come into the schools by the nurses to do catch-up. Usually that's a little bit older grades, when children get into that middle school age, they don't really have those pediatrician appointments as frequently as they do when they're babies, but they still need their immunizations. They need their booster Tdaps and things like that.
Okay.
So we go in to the schools, and with the parents sign the permission slips, we'll be able to give them their immunization right there. Good so point. It saves the parent the trip to the pediatrician, it keeps our children immunized, and it protects the public's health.
Right.
So.
Right, good. And shingles, is that
correct?
A town thing, or is that something that we do?
Shingles is not a town thing.
Okay.
The only reason it's not a town thing is, well, it is a town thing and it's not a town thing, I guess, because shingles is not a vaccine that's provided free by the state. The VNA, because we are a community agency, we purchase vaccine. We purchase the shingles vaccine. We also have a program where a computer program where we can actually bill a person's insurance if they have the right type of insurance, like Medicare Part D types of plans. We can bill the insurance company for them, or we can tell them how much they can expect to get back and what their copay is at least. So we really don't have that as part of a town program. However, this past year, a couple of our towns have actually asked us if we would be able to provide the shingles on site for them, and we've done it.
Wow.
We've gone out to a few of the towns. Although we haven't actually billed the town for the vaccine, the person has paid for it. We're providing it in their town, under their town health department, and facilitating that so that people don't have to come to the dentist's office to
it's
get
still
it.
perceived as a benefit provided by their town, and we're the ones that do it.
That's right, yes.
That's great.
So it's kind of is a quasi-town program, I guess.
Yeah.
And we'd be willing to do that in any town that would like us to come out. We could host a shingles clinic for them. In the town. So,
anything else as part of the town contracts?
The maternal child health visits.
Okay.
We have maternal child health nurses who do see. we have referrals on mostly every baby that's born on Cape Cod. And some moms really need the visit, some moms really want the visit, and sometimes it's the child, maybe mom doesn't feel she really needs it, but every mom gets a phone call.
Okay.
So our nurses call the mom and make sure that they're doing okay, that the baby is gaining weight, that if they're breastfeeding, that's going well, they have no questions, and if they need a visit or want a visit, we can make that visit. And usually, most of the time, insurance does pay for that visit. Fortunately, most insurance companies do pay for that postpartum visit. However, there are those people whose insurance plan doesn't pay for it.
Okay.
So when that occurs, then our town contracts very nicely will reimburse our nurses to go out and do that. So they allow us then to make those well baby visits.
No matter what.
No matter what. So there's no mom that's turned away because of having to for a cost.
Sure.
So
okay.
That's part of the town contracts.
All right. Believe it or not, we only have about 2 minutes.
Oh no! Okay. Wow.
Wow, time flies. You do a lot.
Wow, we do a lot. I think yes.
I know. 2 minutes. Okay.
Okay.
So, town contracts, pretty good handle on what happens with those, right?
Mm-hmm. Yes.
And then, in general, the Public Health and Wellness Department, you have some other, the My Life, My Health.
Mm-hmm. We're doing the My Life, My Health program, which is a chronic disease self-management program. We're involved with the Barnstable County Human Services with a grant that's called the Navigator Grant. And this helps people it's very intensive short-term case management, to help people with disabilities, 18 and over, elders, to help them to get from point A to point B. It's short-term intensive case kind of guidance.
So its purpose is to maybe pick up people that could normally fall through the cracks.
Right.
Help them access programs they may not be aware of what's out there, which is a big problem. A lot of people aren't aware of what's there for them.
Sure.
And that's the county, and that's a human service county program. So, and it was a grant, and it was a competitive grant, and we applied for it, and we were awarded the grant. So yes, we're happy to have that too. Yes. We have adult day health programs.
Okay.
We have two. We have one in Sandwich and we have one in Harwich. And we also have a child care program as part of
And the adult day healths are medical model as
opposed to?
Adult
day healths are medical models, right?
Social.
Which means that they have an RN present, and we can have people who might need to have a glucose test in the middle of the day, might need to have their medications given to them in the middle of the day, so that these are people who would be home and maybe would forget. Or maybe they just need to have a nurse eyeball them every day because they have a little cognitive issues, or maybe just a little unsteady health issues.
Something going on.
And somebody really needs to watch them. So we have a nurse that's available.
That's great.
Also,
and good socialization for the clients.
It's a wonderful socialization for the clients. Right, and you're located at either end of our service area in a way. One's in Harwich and one is in Sandwich.
Okay.
Right. Very happy place.
Child care, and it's very happy
We have
place.
child care.
All right.
A lot.
Good job, you guys. A lot. You do so much. Thank you so much for being here today. I appreciate your time and all the knowledge that you shared. It's a good job. Thank you.
Thank you.
All right. And I'm Jeanne Sarnosky, wishing you good health and good health care.